From MTN News, this is Montana This Morning.
Good Thursday morning. It's 5 o'clock. Welcome to Montana This Morning. I'm Victoria Hill. Thank you so much for starting your day with us. We begin this morning with a court case that could set precedent for Montana businesses refusing to follow local COVID-19 restrictions. A judge rules a Bozeman bar must follow the Gallatin County health order and close at 10 p.m. When making the ruling, the judge said it was not an easy decision for her, but added the orders are presumably constitutional and within the health department's authority. The Rocking R bar had been staying open late, saying they owed it to their employees that relied on a paycheck. If the health order is not followed, the bar's owner could be held in contempt of court. But his attorney said his client will now close his business at 10 o'clock. The Northern Cheyenne Tribe is suing the Bureau of Indian Affairs, claiming the agency is holding up a contract resulting in violent crime, unlawful drug use, and missing and murdered Indigenous women on the reservation. The tribe says because of the BIA's chronic understaffing, they submitted a proposal for a grant worth more than $1 million to fund a new tribal police force. The BIA is in charge of all law enforcement on the reservation and would have to approve the grant. Northern Cheyenne officials claim the BIA intentionally delayed their response, which forced the tribe to miss a November 12th deadline to submit the application. The lawsuit requests the BIA is ordered to enter a law enforcement contract with the tribe. Well, now it's time to turn our attention to weather, and I'm very excited to introduce you to a new face, a new member of the Q2 family and Q2 weather team, Miller Robson. Robson, not Robinson.
I've had Robeson. I was at I did a speech one time, and they said, "Hey, welcome Miller Austin." And I was like, who? Is there another guy named Miller here? But yeah, Miller Robson. If everybody just wants to call me Miller, everybody just knows me as Miller.
All right. Well, good morning,
Miller.
Thank
you. It's very nice to meet you, Victoria, and the rest of the gang.
Yeah, and making your big debut here for Q2 today on the morning show.
I am.
I was excited because I was in on the secret, and I'm like that family member that kind of knows everything that everyone goes to. Like, yeah, Miller's starting tomorrow.
Yeah. Well, be afraid. Be very afraid. No. I do apologize for the next 2 hours.
You're great, and we look forward to seeing what you can do for us.
Well,
so, what can you do for us today, Miller?
Well, I'm going to tell you a little bit about the weather. Here's some good news. Now, I'm a Georgia boy, so I like the warmer weather, and it's going to be warmer than normal today, but don't get used to it. We may see a bit of a cool down a little bit later on next week, but right now it's chilly out there. 37 here in Billings. It feels like 30 with the winds out of the southwest at about 10 miles an hour. Your headlines today, we're going to be mainly dry today, but we do have another system coming out of the west, out of that wacky place we call California. That's going to bring a cold front through. That's going to maybe kick up some showers a little bit later on tonight, maybe some snow on the higher elevations, but we'll be dry and windy all the way through the weekend. Now, as we get into the weekend, especially Friday through Sunday, we could see some winds really kick up, and we'll tell you more about that. And then snow makes a return early next week. And as a Georgia boy that doesn't get a lot of snow, we're not used to snow, Victoria, I'm really, really excited about that. Yeah. And we've already done the sledding, we've done the snowball fights. And a lot of friends were telling me, yeah, enjoy it when you first get there, but
it could
after a while, yeah, it gets a little crazy. But anyway, but today, again, we're going to be about 8 degrees above average where we should be for this time of the year, so enjoy the heat wave while it lasts.
Yeah, it's definitely noticeable when it's a little bit warmer than usual, but good for you, and good timing with the with the snow for next week, just in time for Christmas.
Absolutely. Let's hope we have a white Christmas. Jury's still out about a 50-50 shot, but maybe we can make a few calls and see what Mother Nature can do for us.
Yeah. All right, Miller. Well, thank you so much for that weather update. I'll get back to the news. Well, there will be no public health guidelines for lawmakers to follow at the Capitol during the upcoming legislative session. Instead, the Rules Committee will form a leadership response panel with the power to act if there is a COVID-19 crisis during the session. The GOP-led group can restrict access to the Capitol, but cannot force lawmakers to get tested for the virus or get vaccinated. Democrats had been pushing to require masks during the session, but that and all other proposed health guidelines were rejected by the Republican-led Senate. In education news, Billings students identified as close contacts of someone who tests positive for COVID-19 will spend less time in quarantine. Instead of a 14-day period, students will be able to return to class after 10 days, but kids in extracurricular activities such as sports or band won't be allowed to participate for the full 2 weeks.
So that means students involved with sports will be able to attend the practice, but they will not be able to participate until day 15. Students that are involved with band especially horn instruments, anything that requires, a lot of that would create droplets, additional droplets that go out. We're going to hold those students they're not able to participate until day 15, but they will be able to attend.
The district is considering releasing staff members from quarantine after 7 days as long as they show no signs and test negative, but that is still being discussed. Some Montana educators are also posing an interesting question. Should teachers be moved up the list and be considered earlier for a COVID-19 vaccine? MTN's Cody Boyer explores the discussion.
For healthcare workers, frontline workers, seniors, and many others, the news of a COVID-19 vaccine on the horizon is good news and uplifting for the time of year that we're in. Educators agree, and also agree in the fact that frontline workers should be getting the vaccine first. But they do say for many reasons they should be included in that list.
I think we're all pretty excited about it. The light at the end of the tunnel.
For now, it's just a discussion, one that longtime teachers like Rick Gale, now a guest teacher for schools in the Bozeman area, is actively listening in on.
They are on the front line as well with kids every day with the in-class learning. And at the same time, I hear teachers saying, yes, take care of those first responders, and we do have a lot of people in our communities doing what they do.
To Gale, the effort by educators and others like store employees has been Herculean. It comes down to the possibility of exposure.
They want to make sure the kids are safe, and every day they're putting a lot of time and energy to make sure that that classroom is safe for them to come into. Most communities see the value of our kids being at school as much as they can be. It's been a challenge. We're doing what we can to keep these schools open, but I think we have some good practices in place right now. And yes, all of us want to go back full time.
But Gale says all educators agree. The people who are getting the vaccine now absolutely should be.
I've had a lot of conversations with family, with neighbors, with teachers. All of us agree that our first responders are first. We need to take care of them. They've been on the line for the last several months.
And for educators, their one hope is that they can be considered earlier in the phases.
They're out there doing what they do, another group of heroes.
In Bozeman, Cody Boyer, MTN News.
Thank you, Cody. And making national headlines this morning, another vaccine will likely be approved for distribution as early as today. An FDA advisory committee will meet today to discuss whether to recommend emergency approval for the shot made by Moderna. Vice President Mike Pence and Second Lady Karen Pence are set to be vaccinated publicly at the White House on Friday. President-elect Joe Biden is also expected to receive the vaccine on camera, possibly sometime next week. Meanwhile, the FDA says hospitals are reporting some Pfizer vaccine vials are overfilled. The agency is advising health professionals to use every full dose possible and is talking with Pfizer about the issue. U.S. officials say they're in negotiations for more vials of the vaccine, but as of now, the company has not committed to any additional doses for the United States. Lawmakers in Washington are getting closer to striking a COVID-19 relief deal. Lawmakers say they made more progress yesterday than they had since the landmark aid in March. They're looking at a $900 billion package that would offer aid to businesses, $300 weekly unemployment checks, and $600 stimulus payments to most Americans. President-elect Joe Biden is calling the proposed aid a down payment and is promising more help next year. Many intensive care units across the country are over capacity. Reporter Dan Grossman shows us a glimpse of what it's like in hospitals facing this problem and what's being done to lessen the impact.
That has just added to our already growing numbers.
From a registered nurse.
It's scary.
To her supervisor.
It's scary. We're scared.
It takes a toll on everybody because daily as we come into work, we never know what we're going to be doing.
To the man responsible for tending to emergency ICU needs. The sentiment at the University of New Mexico Hospital is the same.
Social distance so that we could get through this and so we can have the beds we need in this hospital to care for you and your family.
In a country overrun by this pandemic's unrelenting grip, Albuquerque, New Mexico is the epicenter. Last week, 224 ICU beds in the city were reported as occupied, despite the availability of only 192. According to data from the U.S. Department of Health and Human Services, 1 in 3 Americans is living in an area where hospitals have less than 15% of available intensive care beds, and 1 in 10 are in an area with less than 5% capacity.
I don't envy the providers having to, sit there and make the plans for if and when we have to determine who gets care and who doesn't.
Patrick Baker is the director of the Rapid Response Team at the University of New Mexico Hospital. He says surgery units have been converted into ICUs as the hospital has reached a point where emergency rooms are now seeing effects as well.
It's not just affecting COVID patients, right? COVID patients coming in is a big deal, but how would you feel if, you had to go to the emergency room because you had an accident or something, you got in a car accident, and you weren't able to be seen?
And the issue is not just affecting people coming into these hospitals, but the men and women tasked with keeping them running.
Staff to take care of the patients in the beds is more likely the limiting resource that we have.
Barclay Burdan is the CEO of Texas Health Resources, which oversees the Dallas-Fort Worth area. According to the newest numbers from the Department of Health and Human Services, 93% of ICU beds are occupied, straining the limited number of nurses, doctors, and pharmacists who tend to them. It means the need for more trained staff, as well as the possibility of transferring patients to hospitals that might have more room, but might be out of the patient's network.
Wear a mask. Wash your hands frequently. Stay out of crowds.
It has led these first responders to repeat what we have heard so many times before in an effort to avoid a situation that's worse than the one we're currently in.
There's a real possibility that, you show up somewhere to get care, you get in a car accident, they're going to tell you, I'm sorry, we can't help you.
I'm Dan Grossman reporting.
And before we take a break, a powerful winter storm swept through the Northeast overnight, hitting some 70 million people. For many, it's the biggest storm they've seen in years. CBS's Tom Hansen has details on the damage it caused and how the coronavirus pandemic has affected preparations.
Paramedics in western Pennsylvania were checking on a minor accident when a truck narrowly missed everyone after losing control on the snowy road. The storm knocked out power to thousands and caused hundreds of accidents up and down the East Coast.
If you don't need to be out, stay home. Presently, I'm on the scene of a 19-car pile collision.
For many, this also was the first heavy snowfall since the coronavirus pandemic began.
I've been in my apartment for like 7 months now, so what's another day?
Here in New York City, indoor dining is shut down to slow the spread of the virus. Many restaurants have outdoor setups that snowplow truck drivers have been trained to work around.
So our operators are going to go very slowly, very methodically, and do their best to control speed.
The city received more snow from this storm than all of last winter.
I didn't think it was going to come down this crazy.
Schools here will be doing remote learning today, but many others are taking the snow day. Jefferson County, West Virginia schools emailed parents to say, this is one thing our kids won't lose this year. Children in West Philadelphia didn't waste the opportunity to play last night.
Really fun by going down like the hill, and it was amazing.
State and local officials say they've made adjustments to ensure shipments of the coronavirus vaccine continue despite the storm. Tom Hansen, CBS News, New York.
Officials are confident UPS and FedEx will handle the winter storm, and they have extra staff in place to help receive the shipments.